Hi, Mr. Hilliard. I'm Jen. I'm going to be your student nurse today. How you doing?
I'm okay.
Okay, good. Well, I'm here to do a bedside assessment, but before we get started, I just need to confirm your name and date of birth. Can you tell me your name and date of birth, please?
Matt Hilliard, January 15, 1987.
Okay, awesome. And can you tell me if you're in any pain today?
No.
Okay, good. So like I said, we're going to do a bedside assessment. I'm just going to start by asking you some questions. Do you know where you are?
Yes.
Tell me where.
I'm at my parents' house in Standish, Maine.
Okay, and what day of the week is it?
Saturday.
Okay, good. So the patient is alert and oriented to person, place, and time. So I am just going to now check your eyes. So do me a favor and just look straight ahead for me, okay?
Okay.
Good. All right. Good. And now just look at the top of this pen for me and keep looking at it as I move it towards you. Okay, so pupils are equal, round, and reactive to light and accommodation. And throughout this whole time so far, his behavior has been appropriate, his speech is clear, so his neurological system appears to be intact. So I'm going to move to the cardiovascular system, and I'm going to just listen to your heart. Is that okay? All right. So I'm going to start at the right sternal border. This is the aortic area. I'm going to be at the second intercostal space. I'm then going to move to the left sternal border, still at the second intercostal space, and I'm going to be at the pulmonic area. I'll then move down to the third intercostal space, which is the Erb's point, still on the right sternal border. The fourth intercostal space on the right sternal border, that's going to be the tricuspid valve. And then I'm going to move down to the fifth intercostal space at the mid-clavicular line, and that's going to be the apical pulse. So I'm going to check those now. Okay, so I was able to auscultate S1 and S2, and I noted a regular rate and rhythm. So now I'm going to just check your capillary refill time. Looks like it's within 3 seconds, so that looks good. And I also want to check your radial pulses. So I would say this is +2 with a regular rate and rhythm. I'm also going to just move down to the feet and check the dorsalis pedis pulses. Okay. And the posterior tibialis pulse. And still noting regular rate and rhythm and good symmetry on both sides of the body, so that's good. I'm now going to move to the respiratory system. Before we dive into this, have you had a cough or any sputum that we need to talk about?
No.
Okay, so I'm now going to just listen to the lungs. And just on visual inspection, his breathing appears to be regular and unlabored. So I'm going to auscultate 3 sides anteriorly and then 3 sides posteriorly. And I'm going to try to also note the right middle lung. And as I go from one side of the body to the next, I'm noting for any kind of discrepancies from one side to the next. Okay, and I'm going to start up here at the apices of the lungs. Take a deep breath for me. Okay. Go ahead. Good. Good. and just, are you able to sit up, sir?
Yes, ma'am.
Okay, can you sit up for me and just turn your back to the camera? And I'm gonna avoid the scapula as I listen to the posterior side of the lungs. And I'm just gonna listen down on the sides. Okay. Super. So you can lay back down. So the lungs were clear to auscultation. I did not note any crackles, wheezing, or rhonchi. So all of that sounded good. Okay, so now I'm going to move to the gastrointestinal system. How has your diet been lately? Have you made any changes to it? No? And you've been tolerating food okay?
Yeah.
Okay, when was your last bowel movement?
Oh, 10 minutes ago.
Okay. And was it, would you describe the consistency of that as regular, or did you have any concerns with that?
No.
Okay, perfect. So I'm going to have you just lay down, if you will, a little bit more. So first I'm just going to visually inspect the abdomen, and I'm not noting that there's any kind of distension upon visual inspection. So now I'm just going to listen to the bowel sounds in all 4 quadrants. Okay, so I'm hearing normal active bowel sounds in all 4 quadrants. I'm now going to palpate the abdomen. Just let me know if any of this is uncomfortable or tender for you, okay? And again, I'm feeling in each of those regions. All that okay? All right, I'm gonna go just a little bit deeper this time. Again, let me know if there's any pain that you feel or discomfort. All of that was okay?
Mm-hmm.
All right, perfect. You can go ahead and sit up. Okay, let's just talk about your peeing for a little bit. When was the last time that you were able to pee?
The same time I had my bowel movement.
Okay, and have you been able to pee regularly?
Yes.
Okay, what was the color?
Pee color?
Mm-hmm. Like, was it clear or yellow or light yellow, dark yellow?
Lightish, yellowish.
Light yellow, okay. And was it cloudy or clear?
It was clear.
Okay, perfect. And when I was palpating the abdomen, I didn't know any bladder distension upon palpating or visual inspection. So all of that looked good. Okay, so next we're going to move to the musculoskeletal system. I feel like I'm forgetting something, but it's okay. We'll move to the musculoskeletal system. So first, I just want you to squeeze both of my fingers, and I'm feeling for the symmetry on both sides of the body. Just squeeze real tight. Okay, perfect. Now I want you to, you can let go, and then push on my hands. Okay, good. And now I want you to resist my hands. Good. Now I want you to use your legs and push up on my hands. Okay, awesome. Can you move your hands up and down? Awesome. So I'm seeing that there is good symmetry on both sides of the body, an adequate amount of strength, and a good range of motion on both sides of the body. So all that looks great. Okay, I want to check out your skin as well. It does appear to be warm, dry, and intact. Are there any wounds, bruises, incisions that we need to take a look at? Okay, perfect. And I just want to do a check for skin turgor. And it looks like that popped right back down, so he has good skin turgor, and all of that looks great. One last thing I want to do is just check for any edema. I would actually normally do this with the cardiovascular system. Okay, so all of that looked good. So that's going to conclude the bedside assessment. Do you have any questions or concerns for me?
When can I get out of here?
Soon. You are well on your way.
Fantastic.
So I'm going to put the bed rail up. I'm going to move, make sure the bed is in the lowest position. Here's your call light. If you have any issues that arise, just push that button and one of us will come. Is there anything else I can get you right now?
How does this work?
You just push the button.
Perfect.
Okay, I think that's it. Thank you. I'll be back soon to check on you.
Thank you.